Time now for this week's Health Matters, KFUG Community Radio. Paul Critz with you, along with PA Lynn Szabo. And we're joined this time around by Dr. Terry Raymar, a family practitioner at the UIHS down in Humboldt. And why are we talking to Dr. Raymar today, Lynn?
Because he has some great insights on flu shots, and I thought a second voice would be really good.
Well, 'tis the season, too.
Yeah, 'tis the season. We're getting close to the time. So super excited. I saw a couple of emails, and I really liked what he had to say about it, so I invited him to be on the show. But he also has experience at KHSU's Health Dialogues. So that was a show that he did back when KHSU was more local. So I'm interested in what he has to say. Dr. Raymar, where should we start?
Well, the first thing I'd like to do is kind of set the table. Of course, like you mentioned, flu season's coming up, and so that's why we're kind of talking about this. But I also want to give a little disclaimer in that I'm not a flu vaccine expert, but I do, make myself competent in issues about the flu shot, and I am an expert in, taking care of and caring about my patients. That's the part that I really am passionate about,
absolutely.
And wanting the best for them. I always think of my patient as part of my family,
Yeah, absolutely. And you do see a lot of Delnort patients, I think, or have involvement in their care, maybe indirectly. So
I have.
We appreciate it.
Yeah, I have in the past, and I also have, I think it's important to say this at the beginning. I have no financial interest in the matter. Okay. I don't have any.
We don't have to worry about big influenza.
Stock in flu shots or anything. Yeah.
Thanks for that. That's a good note.
We appreciate that.
Yeah. But I also want to say that I don't want to give a fire and brimstone talk about how you have to get your flu shot or, horrible things are going to happen, but rather try to provide a table of information and allow people to make good decisions for themselves. And then whatever decision they make, that's great. That's kind of the way we approach diabetes, which I treat a lot, but I also feel that way about everything in medicine.
So like you're an advisor and the patient can do what feels best for them, but as an educated decision. That's good.
Right. Yeah, we collaborate on that.
Yeah,
and I also kind of...
I was going to say there's definitely trust issues out there lately. So.
Right, and that's about what I was about to say, because we have to kind of talk about that at the beginning, because there are a lot of things that happened in medicine in the past that made patients legitimately mistrustful of the medical community. And if we don't acknowledge that and say we're trying to make that better and, we're not going to put up with that anymore, people will continue to not trust us. But, I acknowledge that those things have happened. They've happened in the Native American community, the Black community, the disabled community, and we have to say, okay, we're gonna have a different model. And so I've really looked into these things. I'm sure the pharmaceutical companies make money off them, but they do, I do feel some trust in the process of the flu vaccines and such, because, I've looked into that, and as we'll talk about a little later, I apply those to myself as well. So anyway.
Awesome. So where do you want to start? What really, can you tell us about the flu and maybe what the expectation is for this year, if they know?
Yeah. So that's a good thing. It's like, why do we care about the flu? Well, it turns out the flu can be, for some people, a serious illness. And it's not always the flu that itself that ends up causing the person to become extraordinarily sick or die from it, but rather it kind of, the process of this overwhelming infection sort of weakens your respiratory and immune defenses. So you are more susceptible to have a pneumonia. In fact, that's where the bacteria Haemophilus influenza came from, because it was often on the heels of the influenza virus.
Okay.
And so there are these pneumonias and other things and
kind of like opportunistic secondaries. Yeah.
Yes, and sometimes shutdown of organs that can come from the virus itself. So it can be, really overwhelming and cause serious illness for some people. And we'll talk about a little bit later about, who's at risk and who,
Right.
like we want to target for these things.
Okay.
But I also wanted to mention about how contagious the contagiousness and talk about virulence a little bit when we talk about the flu, because
Right.
there's something called the RO
R9.
number.
Which we've talked about.
Yeah.
Yeah, we've talked about it on
Oh,
the
good. Yeah.
Yeah, but
yeah.
refresh our memories.
Yeah, well, flu has an R naught or an RO number of about 1 to 2, and that's contagious, but not terribly contagious. Like the measles is about 13 or so.
Right.
That's what they quote.
Uh-huh.
So and what that means is you're bound to get like 1 or 2 people sick when you get sick. But with the measles, you can get up to 13, 14 people sick. So that's one thing. But the virulence is like how sick a virus can make you, and that's the part that's the problem with the flu.
And there's different strains, right? So
Yes,
do you think
there
that
is,
some have more
right.
virulence and some less? Maybe.
Yeah, probably. So yeah, that's something where I'm not really an expert on, but there are, like, it depends on the factors, that the H and the N factors, and
Right.
what the combination is that year.
Uh-huh.
So the virus that we're dealing with in the flu is a throwback to the 1918 virus. Still, it's
wow.
still the virus variation that's circulating, and but it just keeps changing and tweaking itself. So at any rate, there is influenza A, which is probably the little more virulent of the two, and then there's influenza B, and then there's different strains of those. And that's where I'm not really a detailed expert, so I won't
Right.
say any more about that.
I think we've been seeing mostly A up here, at least last
Right.
year. Although I have seen a little bit of flu this summer, like rarely, but it's always kind of out there. So
Yeah, it can circulate, and it tends to move around the globe in waves, but it can still show up other times of the year, right?
right. So and they kind of tailor, they meaning I guess scientists who formulate flu vaccine kind of tailor it to what's expected for a winter.
Right, they
but
do
it's-
surveillance.
Yeah.
Yeah, they do surveillance in other countries, and then they pick out the strains they think are most likely. And sometimes they get it right on, and sometimes they don't get it quite as close. And we often don't know until flu season actually hits. So that part is a little bit of it's a educated guesstimate of what's going to happen. So.
Right. And yeah, sometimes they're really close and sometimes not. And I would say clinically with the flu, this is my 2 cents, is we often counsel people with viral syndromes to not come in immediately and to stay at home and do conservative treatment. But with some of the strains of influenza, they can be treated if they're treated early with Tamiflu, or I guess mitigated is a better word than treated. So we can make people a little bit less sick for a little shorter time if we're lucky and if people get in early. That's my 2 cents.
And
Yeah.
I think that's exactly right. And if they have a little bit higher flu or their symptoms are a little more intense, myalgias mixed with a fever,
Right.
that's the kind of person we want coming in to see us.
Coming in sooner rather than later. Also, maybe the person with risk factors, which you'll get to. So,
Right.
So,
Absolutely.
Are these safe? Are these vaccines? What's your thought on safety here?
Yeah. Well, that's good, because there's been a number of different things that people worry about, and one of the things that, although rare, is the syndrome of Guillain-Barré, or the chronic inflammatory demyelinating polyneuropathy, which we call CIDP, so we don't have to say that big
We
long
don't
name.
have to, oh, that sounds scary.
Yeah. But what this is it's something that happens after the flu that can attack your nerves and cause them not to be functional. So you can lose sensation and even your motor nerves. And we've seen this rarely after the flu vaccine. So just to put it in perspective, there's about 1 to 2 extra cases for the flu vaccine. But if you get the flu, it's up to 40 times, more common than that. So it's much more common from the flu. So it's better to get a flu vaccine and in that regard not worry too much about that. But if you've ever had Guillain-Barré, you do not want to get a flu shot. So that's the important point there. If you've ever experienced any of those symptoms, I would counsel my patient, if they've ever had that. In fact, I've had patients with that and we don't give them flu shots.
Yeah, and you don't have to worry about whether you had it or not. You will know Guillain-Barré is. I've seen it once in my 36-year career, secondary to probably generic virus in the community, and it was super obvious, diagnosed early, and devastating for the young man. Although most people survive, right? It's just awful to go through.
Yeah, and how chronic it becomes is really variable from person to person. Some people have a pretty good recovery and some people don't. And so we don't want to reignite that by giving a flu shot if people have had that in the past.
Okay, good advice.
And, then there's egg allergy, which they've taken the egg proteins out of the vaccines. However, if you're there are still vaccines that are made without eggs at all. So if you're really concerned or you've had anaphylaxis and it's still a really powerful concern of yours, you can request non-egg, made flu vaccines.
Flu vaccine. And that would have to be anaphylaxis in place, a super severe allergic reaction, not like my mom said it made me cough or something. So and they've taken the protein out, so it really shouldn't be an issue for people. But out of an abundance of caution, if you have people with that anaphylaxis, you might choose the non-egg.
Doctor, is that something that's like readily available the time of when somebody goes in? I mean, are there stocks available, or is that something you have to pre-order? I guess.
And there comes my disclaimer. Usually, I think most big clinics will have that. Probably smaller private offices may not. Okay. And so that's a good question. And they may say, well, here's your option. You can go to this other place to get a flu shot. And for instance, I know they give them at pharmacies. So I don't know the answer to that question.
I bet you in Del Norte. I bet in Del Norte it's the public health department. Yeah, is where I bet they have a small supply, and that's where they keep it. And that should be easily accessible if you know where to look. So good advice.
And then there's issues about some people have said, well, I get the flu whenever I get a flu shot. So it's really important to let people know you can have a minor reaction to the shot, like you can have a little low-grade fever and maybe a day or two of, feeling a little achy. But because most of the viral vaccines are recombinant, you cannot get the flu from those. And they do have live attenuated viruses for like younger, healthier people. But if you're worried about that or have experienced something that you felt was that, then you can ask for the recombinant one. So this gives you a lot of options for people who are worried about safety, especially of certain things.
That's interesting. I did not know that these choices existed for people. Often on the show, we talk about how you need to be your own best advocate and ask the questions that need to be asked in the exam room. I had no idea there was a menu of vaccine options available.
Yeah, there are. You might not be able to get it at your clinic, but can you explain recombinant versus live for people that have confusion about that?
Sure, as best as I can. Live attenuated viruses are the actual virus, but in an attenuated way. It's disabled so that you just get the kind of the proteins, but it's not in a way that can attack you as a virus would. So it kind of exposes you to the things of the virus, but it's still considered live and attenuated. It's still considered live.
Okay.
But recombinant is actually pieces of the virus that are made usually by a bacteria that has the DNA incorporated into its DNA, and it just churns that stuff out. And so you get a bunch of antigens from the virus itself. And those are the things we're putting into our, system to cause our immune system to react to them. So when the virus shows up, they see those antigens, those proteins, or whatever the product is, and they attack it like it was, as they attack the virus itself. And that's the way a vaccine works.
Oh, that's cool.
Super cool. It tells our body to produce an immune reaction. And so the recombinant is nice for people who are concerned about that.
And it's just to clarify for people who have concerns about messenger RNA viruses or vaccines, sorry. This is not a messenger RNA vaccine. There's a lot of concern about that up here, but no need to be. So.
Well, flu isn't done by messenger RNA yet.
Right.
I mean they may move in that direction because it's effective and works well, but not now.
So does this even work? Does giving a flu shot work? Because I hear a lot of people in the room say, I got my flu shot and I still got sick.
Yeah. And this is one of the problems with that, the surveillance-based making the flu shot. So this is a part where we have to be really honest with our patients and say they work pretty well most of the time. They can prevent disease somewhere probably 40 to 60% of the time on a standard season. Right. But sometimes people will get sick still, but it will also make the sickness less severe. If you get exposed to the virus and you start to get sick, your body already knows to attack that virus, and so it doesn't really get the upper hand on you. Does that make sense?
That totally makes sense.
And so even though they don't work perfectly, even though they may not work to make you not get sick, they do keep you from getting too sick. So it still, if they're not working fully to prevent disease, they're still helping in that case.
And so then hypothetically, they could help people maybe with risk factors who had secondary problems from the flu. So if your immune system is fighting the initial flu infection better, then maybe you don't have to go into the secondary, more severe, Haemophilus infections and stuff like that.
Right.
Yeah.
And that sort of takes us to that area of like, well, who's really susceptible to that kind of thing? Right. And this is where we get into, the elder folks who might be more susceptible to a severe flu illness, or people with chronic conditions like, say, diabetes, asthma, the COPDs, the chronic obstructive pulmonary disease folks, those kind of chronic diseases.
Right.
And interestingly, also pregnant women are more susceptible to complications, probably because their immune system's a little tweaked by the pregnancy.
Right. Absolutely.
So they're a little more, So these are the kind of people we really want to target, for the flu shot.
Right. Yeah, I spent a lot of time talking to the pregnant ladies I take care of, and do you have any? Can you give us any sense about how it might protect a neonate, say, who's nursing? Do you think that immunity would be passed on?
It should be, and in the first, you don't give flu shots to kids who are younger than 6 months, excuse me.
Right. Okay.
You hold off on that. So the mother should pass in her breast milk some antibodies to the infant to help protect them if she's breastfeeding. That would be the theoretical, advantage to them having had that.
That would actually be their only protection that's medical. I mean, other than hand washing and isolation and things like that. So
that's exactly right.
Yeah,
that's a really good point.
Yeah. Awesome. So Let's see. And so who are you recommending? All these that you're recommending, all these people should be getting them, but there's different kind of shots, aren't there? Like I think elders get a different kind of shot than say a kid. What can you tell us about that?
Actually, yeah, that's right. We do. There is a general recommendation that all people who don't have a contraindication over 6 months get a flu shot. But having said that, there are people that we're going to target, and I mentioned those folks. And for instance, for folks who are older, there are different viruses because their immune systems, as we get older, our immune systems aren't quite as robust. They don't, kind of have the oomph.
Right.
So
exactly.
you have a. I like my wife's analogy. You don't have a Mustang anymore. You have a Volvo or something. It's just
your mom's
it's
Datsun.
still running pretty good, but it doesn't. It can't go from 0 to 60 quite so quickly.
Right.
And what happens is, so they put these vaccines together to kind of boost the immune response. So they put 4 times the antigen, or they put something called an adjuvant, something that kind of spurs the immune system into action.
Right.
And that helps protect those people. So
over age 65 or with comorbidities probably should be asking in the exam room for the more, I guess, va-va-va-voom flu shot.
Yeah, I think it's the flu. Yeah, there's the Fluzone,
right,
quadrivalent, and they're usually called quadrivalent vaccines.
Okay, all right.
So yeah, I guess did you mention the flu block? Yeah, that's
yeah.
Oh, the flu block. I thought you mentioned the flu block because, again, I'm not an expert in vaccines, but I think that can be given to younger people.
Yeah, I think people will figure out what you're saying. So.
Yeah. You want to talk to your provider at the time. Usually, providers will know. They'll have stocked those for people over 65 if they have a general practice. It's not,
Right. And for kids. Patients at UHS, we have a vaccine nurse named Greg who is probably accessible and could answer a lot of questions directly, and he's the bomb. He's great for information.
Yeah, he is wonderful.
Yeah. But kids, though, I see a lot of kids that only get one flu shot, and then nobody seems to be aware that they need the second one. Am I confused on that, or what would you recommend?
I because I don't do pediatrics, I don't know that answer. I'm really sorry, and I
think it's 2, and I don't know the time interval. I'll get back to Dr. Matsuda and clarify that. And so, that's good to know.
That would be a good thing to, do a clarification on, because I don't want to talk about something I don't really know about.
Sure.
So, yeah.
So, do you get your flu shot? Does your family get
I actually do, and this gets into the sort of the touchy-feely aspect of this because this is a personal thing for me. I have been in this community for a long time, and I've worked with a lot of the families I've had for a long time, and I love them as if they were my family, and I want to protect them. So when they're here in the office with me, something that people don't realize, you can pass the flu on to other people before you're sick, before you even feel sick, like in the first 48 hours. So I don't want to be sitting here in the office breathing on somebody and get them sick, because I didn't get my flu shot. So I get my flu shot every year, and when you think about it, the more of us that get our flu shot, the more we're protecting other people around us. And this is why there's a recommendation for everybody that can get a flu shot. So say there is somebody who has had Guillain-Barré around them, the people around them should get a flu shot so they don't give the flu to that person and re-expose them to that sort of thing.
That's
so
exactly
we're all protecting each other.
Right. And I of course, work with a lot of newborns and infants under 6 months of age, and that's why I get my flu shot. And when my children were young, that's, I didn't want to bring anything home from work to them. And
that's right.
Yeah, and I have elders in my family, and so I protect them also. So not only protecting yourself, you're protecting the vulnerable in our population, and I think, at least with our family, we owe them that. So.
Yeah. And who doesn't have extended family that has some chronic conditions?
Right.
You know, I think we all, if we're, you know, with around family, you know, that's it's a reason for thinking about getting our flu shot. You know, at least considering it. You
Absolutely.
So, doctor, I have a question here in the time we have left, about 5 minutes or so. A couple of years ago, one of the most vehement responses from a listener that Lynn ever got was from a woman who was in healthcare as well here, and I forget where she was, you know, in the strata. But Lynn had advised waiting perhaps until like closer to Halloween to make sure that you get the most bang out of your vaccine buck as you moved over the dead, you know, the low point, the nadir of winter. And this woman was just livid, like, no, as soon as you possibly can, you get vaccinated. You do not wait because you'll get sick and die. Do you have any thoughts on the timing of the initial vaccination and then also the timing of a subsequent vaccination later in the season for those who need it?
Hey, Terry, speak freely. When do you get yours?
I get mine pretty early in the season, but I don't, you know, I think there's a little bit of a theoretical thing here because it depends. I would say it depends on where you live. If you live in a big urban area, a metropolitan area, I would recommend you get a shot early on because the chance of the virus coming into that area, up here on the North Coast, we tend to see the waves of flu that kind of come in after it's established sort of other urban places. So this is a little bit, it gets into a little bit of the theoretical aspect of things. The theory is if you give it a little later, your coverage lasts longer, right, into the season. So if your flu season hits late, you'll still be covered. You'll still have a robust immune response. This is a little bit academic, and I don't think anybody can tell you the actual perfect answer for this.
Okay.
You know, it depends on how
Plus
well
you're I'm sorry, you always have the option of getting a second one, you know, later in the season.
And so if you're worried about that, you can do that. But I mean, it's nice to have it one and done for most people. You know, just having a vaccine for a lot of people, it's a pretty big deal. So up here on the North Coast, you know, you may hedge your bets a little bit and get it a little bit later. But if you're going to be traveling a lot or exposed to a lot of people or be in an urban area, get it early. Yeah, I mean, that would kind of be my breakdown for it.
Thanks for that.
Is there any concern about the second vaccine? Is that something I was the first time Lynn told me she got a second vaccine? I thought, "Ooh, who are you?" And then, I mean, is there any sort of guideline you can offer about whether or not you feel you might need a second vaccine? Who gets those? Who should have those?
You're getting out of my territory.
Okay.
I'm so sorry. I don't. This is where you want a flu vaccine expert to talk to you. I mean,
talk to your doctor.
I know. I know that. I know that's a theoretical concern that you can do that, and we've had that in our older folks that occasionally, you know, we were very highly concerned about.
Right.
Maybe had a bad case of COPD or something, but it's not something I generally would think about or recommend.
So, Dr. Raymar, we have 2 more minutes, and I wanted to pivot just a little bit. How excited are you about the RSV vaccine? We can talk about it in detail another time, perhaps, but... Yeah.
Well, that's something, again, I'm not really... Okay. I know that, you know, that the vaccine... for the older folks might be very helpful, and the shot for the younger folks is kind of not a vaccine. It's what you're doing is you're giving them antibodies to protect them. So there's 2 different things there. There's a vaccine for older folks, and then there's antibodies for the kids. Okay. And that's about the extent of my knowledge. And I think, you know, if you're an older person who is at risk, I think it sounds like a good idea, but for people who aren't at risk, I would, you know, I tend to want to give vaccines for high risk scenarios.
Got it.
You know, so when somebody comes to me for instance, the shingles vaccine, I don't think a shingles vaccine ever saved anybody's life. So if they're want to get the least number of vaccines, I'm like, maybe you want to hold off on that. RSV can be really serious for somebody with COPD, but anyway.
Super exciting. I hope you can consider coming back again. You're such a rock star, and I know that you're, like a diabetes, that most of your career has been focused on diabetes, and prevention of diabetes would be a super interesting topic to our listeners. I appreciate you.
Sure, I'd love to talk
helping.
about that.
Yeah, super appreciate you helping today.
Dr. Raymar, yes, thank you. Any last
pleasure.
thoughts just about flu season and vaccination?
Take care of yourself and get lots of sleep, because sleep is your best immune defense. That's what I would say. It's really important. People think that the thing that makes you most susceptible to illness is not getting enough sleep. Isn't that interesting?
That
Who would have thought?
And working on Sundays. Thank you again for calling up and speaking with us, Dr. Raymar.
Okay, you bet.
All right, calling from UIHS, and I guess he was working in his office today down in Humboldt. Lynn, thank you so very much for lining that up, and I'm gonna get a little closer to Halloween, and then I'm gonna get out and get my vaccination for the flu season. Any last thoughts?
No influenza I know of in the community right now.
Well, okay.
So signing off.
It's not too late. All right. Well, thank you very much, and we'll talk next week. Health Matters.
Thank you. Bye-bye.